Ohio and the nation are dealing with a health crisis. The rate of infant mortality is on the rise in our state, with an increasing number of babies dying before their first birthday. Licking Memorial Health Systems has recently joined the Ohio Hospital Association Infant Safety Campaign, and it's a campaign with the purpose of raising healthy babies. Joining me is Rob Montagnese, the president and CEO of Licking Memorial Health Systems, along with Mike Abrams with the Ohio Hospital Association Infant Safety Campaign, and welcome to both of you.
Good afternoon, Gail.
Sadly, we have to have this discussion, but it is good. And I would think, Rob, that you work in a community hospital, you see the need, and so you've decided that we have to take part and try to find the answers.
Yeah, no question. I think as a state, the health care that's provided in Ohio is outstanding, but this is a measure we've identified that we need to do better throughout the entire state. And I think we've seen that the actual clinical care is quite good from the OBs and within the hospitals, and it's really important, and what you're going to hear a lot about is what we do in the communities, educating folks outside of our walls more than the clinical care that's delivered inside of the hospitals.
But you've talked about that before, that education in many regards to all kinds of different health issues is outside the walls of your hospital.
There's no question. I think I'll use the props in front of us here. This side up, safe sleep is something that we would expect to be very, very common or understood, but perhaps for grandparents or those who've had children many years ago, having infants sleep on their back was not what they were taught. So perhaps re-educating or reinforcing the importance of the safe sleep is just one measure or one metric that we're using to try and reduce this infant mortality rate.
Well, Mike, the Ohio Hospital Association proves this is a statewide issue, and it's a statewide problem.
Right. We have about 138,000 births in our hospitals across the state every year. So sadly, about 1,000 of those are infant deaths. They don't reach their first birthday. We know just from looking at data that one of the big contributors to those infant deaths is safe sleep. So about 3 babies a week in Ohio alone die from unsafe sleep.
Well, explain what you mean by safe sleep and what you want parents to do. So there's one takeaway from this interview today of what moms should be doing.
Well, it's real easy. ABC, a baby should be put to sleep alone on their back in a crib. So a lot of our safe sleep campaign is aimed at educating not only the parents and the public, because we know that a lot of times babies are cared for by aunts and uncles and grandparents. So one component of our campaign is what Rob is doing so well in his community, is educating the community at large. Because for a lot of parents, it is counterintuitive. We were taught to put babies to sleep on their bellies.
With stuffed animals and blankets.
Bumpers.
Bumpers, yes.
Absolutely.
We didn't want them to hurt themselves and be comfortable. But that can cause smothering?
That's exactly right. A lot of SIDS deaths are related to unsafe sleep. So part of our campaign, as you'll see here, is to offer, we've distributed more than 25,000 of these kits across the state so that parents can have a little diaper bag with a onesie in it that is a gentle reminder every time they put their new baby in a crib that they should be doing so on their back.
And Rob, what other kind of education goes beyond this?
I think there are a lot of other things you can do relative to the health of the mother prior to the birth. The use of progesterone, so we don't have as many preterm deliveries. Smoking cessation. We know that there are a lot of mothers who are smokers, and obviously that contributes to a lot of complications after the baby's born with other health conditions. Breastfeeding. We have a significant program where we make available breast pumps and a lot of education for breastfeeding. So there are a number of other things that you can do to help the delivery go more smoothly, the mother's health obviously be better, and ultimately then the baby to be healthy that first year.
Well, this took kind of a long time to get where we are, right, Mike? But I guess we have to start somewhere in hopes that we reduce those baby deaths.
We're gratified that virtually 100% of the hospitals in our state that are delivering babies now, they're all participating in this campaign. So I think you're really seeing the hospital community come together and the community at large across the state to reduce this. We know that we're right now 47th in the nation in infant mortality, which is not a statistic to be proud of. But I'm optimistic because there is such a huge push across the state to address that and really tackle that data.
And you're doing the same in your community, aren't you, Rob?
Absolutely. Once again, I think through the leadership of the OHA, It's given the opportunity for community hospitals to take what we've put together at the OHA board and OHA administrative level and implement that in their communities. Once again, I think the collaboration is key. Making sure you work with other constituencies in your communities, that's what will allow the most success, I think, in any community, and hopefully we feel we are doing that, and we will continue to do so.
Great stuff, Rob. As always, thank you, and it's a pleasure to have you as well.
My
Thanks,
pleasure.
Mike.
Thank you.